related to some other color flow, I would think, because this valve just opens way too well.
Did you see much turbulence there with the color flow?
I did not either. I did not think there was a great deal of turbulence through there at all, and not a lot of aortic valve insufficiency, which would be leaking of blood flow back this way. So as the heart squeezes, it's supposed to go this way, it tends to come back, and really didn't see that much at all as well.
So an important point here is this transesophageal procedure really augmented and helped us, because with the standard transthoracic approach or through the chest approach, this patient had findings that suggested that it might be quite a bit of narrowing of the valve and much more severe than it appears with this. So we're getting really different information and much clearer information with this study. So it demonstrates that this type of procedure is especially good in evaluating valve disease.
I agree. I think it clearly points out, again, what we talked about a little bit earlier, that the fact of doing this study, it is an invasive procedure. Clearly, as you can see, patients do very well with having this procedure done. And the added benefit we get out of this procedure, for this patient specifically, is going to be huge, because we were talking a little bit before we did this about very active young lady, soccer, running, all, active sports. And I think clearly with seeing this now, she just truly has a bicuspid valve, which a lot of people have. But with no gradient, it's going to let her be active and still do all the things she wants to do. It's something that needs to be followed long term. We need to watch that valve, and routine echoes, not transesophageal echoes, but routine echoes to follow how that valve does. But, I think it changes what was going on significantly for us at this point. And good point about this is a very important procedure that changes the course of things significantly.
It really helped with patient management as well as just diagnosis, didn't it?
I agree. This will absolutely change management and how we treat this young lady at this point.
Mike?
Bill, I have a question at this point. I often see patients who have a condition called atrial fibrillation, and if untreated, they can develop clots in their heart, and those clots can flip out of the heart, go to the brain, cause a stroke, or more often when I'm treating them, they go to an arm or a leg, and I'm having to do an operation to clean them out. Would you say that once that condition has occurred, that it would be better to go straight to a transesophageal echo rather than a regular echocardiogram?
If there's actually a clot that's been...
if there's actually a clot that's been diagnosed from the heart.
I think in your case, when you see a patient with a clot in the leg or an arm or something like that, we should definitely do a transesophageal echo, because our images are better, as you could see here, for valves, but they're also see the left atrial appendage. We can see a myxoma, which is a somewhat unusual tumor, or other tumors of the heart, other clots in the left ventricle, a lot of different areas we haven't touched on. But
in fact, Bill, if
very helpful.
If we come back in here, I can actually show you again what Mike was talking about. And again, we showed this earlier, but that's that left atrial appendage that you and Mike were talking about, where people in atrial fibrillation get a clot inside here. This is really clear in here. This black means it's good. A clot would look like a white floating
round
structure.
Glass or
and again,
hazy white.
Exactly what you said. That thing flies out of there and can go anywhere in the body, and then has some problems with that. So that just shows you kind of what you guys were talking about right there.
Yeah, I think your patient would be very helpful, because that's a very major thing, and we want to see if there's anything we can correct or what medication would be helpful. So atrial fibrillation, which I don't know if the audience is too familiar with, but it's a very common condition where it's an irregular heartbeat. It occurs it's fast lots of times. An irregular patient may have symptoms or may not. And it depends on the heart rate, basically, how much symptoms occur and if there's other underlying heart disease involved. But the big risk is a risk of really a stroke that happens all of a sudden. Patient may not even know they have atrial fibrillation, and they're doing fine, and all of a sudden they get a clot in their leg, as Mike says, and the leg goes numb and white and that sort of thing, or they may have a unexpected stroke out of the clear blue sky. So atrial fibrillation is a very important thing to know about and treat, and under many circumstances, not all, but many patients do require long-term anticoagulation with a medication called warfarin. It's a generic name, or Coumadin, the brand name, in order to prevent these complications. And with good management, Coumadin or warfarin is a very tricky drug, and it's a blood thinner, needs to be managed right. Too much can cause bleeding. Not enough won't be effective. So a blood test called a ProTime is done, and this can be done in a doctor's office or in a lab, and done every so often, and that regulates you use the ProTime to regulate the amount of Coumadin you want to give the patient, and this may vary from time to time. So we just can't do one blood test and forget it for 6 months. You need to do it, on a regular basis, once a month or whatever the doctor recommends, and that depends on the individual patient. But it has to be watched carefully and monitored. If that's done, then the blood thinner warfarin Coumadin is relatively safe and very effective. Is there anything else new in the peripheral vascular disease side that we need to know about here tonight? Is there some new equipment that's come aboard, or are we doing other things in that arena?
Well, there's always new devices that come out. Sometimes there are reinventions of devices that we discarded 10 or 12 years ago, and so there is a lot of hype, I think, about laser and rotoblader, or the newer device that's made out of a company out of Minnesota. But I think that the thing to know about peripheral vascular disease is that you really have a good team taking care of you, because sometimes things are much better treated with a surgical bypass, and some things are better treated depending on the patient with either simple balloon angioplasty or stenting. So
you're saying a team approach is the best approach?
Yes.
I think we all agree with that. I know Mike does too, but I strongly agree with that, because we need to use put everybody's mind together when we see a patient. It's any patient, really. We're talking about vascular disease in our cardiac and vascular center here at Shawnee Mission, but treatment of any patient with any type of disease process, the more collegiate atmosphere you have and the more minds that work together, it just comes out better for the patient. We get all views of treatment, and we try to do that on a daily basis in our vascular center, so the patient gets the best care. And sometimes it's stents, sometimes it's surgery, sometimes it's just medication, sometimes it's a combination of everything. So you really need to orient yourself to the individual patient. And I think that's also one of the strengths of our hospital, as we're a strong community-based hospital that really is interested in taking care of the whole patient and making the patient important and not just a number. And we try to do that through our entire program at Shawnee Mission, including the cardiovascular programs, but also health-aware programs where we have nurse clinicians screen patients to pick up problems that need treating, especially cardiovascular problems. We have a cardiac rehab unit, which takes care of patients after heart surgery or after myocardial infarction, a heart attack. And we also have a wellness and spiritual center, which is very helpful to some patients to get over their illnesses and deal with it as best they can. So that's also a big help. So we look at the whole patient. One thing I like to ask Jeff about, and that's the overall wellness situation. He has a personal experience with that. Are you there, Jeff?
Yeah.
I think it's a good time maybe to bring this. It's sort of shifting gears a little bit away from vascular surgery, stenting, and echoes, but into a more, say, practical area here that we all deal with every day.
Absolutely.
That's ourselves.
I would call it preventative maintenance. And, I probably missed out a little bit earlier, but, it doesn't hurt to reiterate a little bit, risk factors for all of this that we're talking about, vascular disease, cardiovascular disease, the risk factors are basically the same, and that's, part of that is, if you have diabetes, managing your diabetes. If you have high blood pressure, managing your high blood pressure. If you smoke, you need to stop today. And, watching your cholesterol. And I think the other one that's important that actually took me a little while to learn was diet and exercise, to be honest with you. Very important from that standpoint as well, too. Personal experience, I've lost 110 pounds over the last 2 years. That was with diet and exercise, not any surgical approach for me. And, you feel much better, and it definitely, studies showed, those are some of the risk factors as well, too. And I think that ties into general health and taking care of yourself as preventative maintenance. And I think being physically active as much as you can do and getting your weight down is very important, not only for your health long term, but also to feel better. And I think that clearly ties into all this that we've been talking about.
Yeah, I think that as Jeff said, your blood pressure will be lower, your cholesterol level will be lower. If you have diabetes, which we hadn't talked about much, but diabetes is a very important disease. It really deserves at least an hour by itself and another webcast. But diabetes is very often associated with vascular disease, and metabolic changes that occur with diabetes or fat